So tell me about yourself. Whenever you come across this question during your interview, so it is basically your professional pitch of your career, education, experience, etc. So in a hospital or in a healthcare setup or any other organization wherever you are appearing for an interview, interviewer frequently asks this question, and how to appear for this question, how to answer, and what you should include, we will discuss in this video. So welcome you all on Docthub. I am Dr. Sandeep Patel, founder and CEO at Docthub, and today we are going to discuss how the healthcare professionals should answer this question, tell me about yourself, in your interview. So you may be a student or a professional in a nursing or a paramedical, allied health or medical or dental, physiotherapy, pharmacy, etc. different streams in a healthcare. When you came across this question, tell me about yourself, what should you need to include? So you should include greetings whenever you start answering it. Greet interviewer, then your full name, native place, your professional punchline, recent qualification, training attended, and sixth aspect is work experience. In this work experience, you should portray your skills. So all these six aspects you should include in your answer, and make sure that your answer, you should complete it within 30 seconds to 1 minute. So within 1 minute you should finish this answer. So for example, if we take different examples of your professional punchline, if I am a MBBS graduate, so my punchline could be, I am a MBBS graduate with a special interest in pediatrics or special interest in critical care or orthopedics, etc. Whatever your interest, you should include here. For the nursing graduates, I would say I'm a nursing graduate with a qualification of GNM. For pharma graduate, I will speak I'm a M.Pharm graduate with a special interest in pharmaceutical quality control. You should include your special interest or specialization of your during your M.Pharm master or any fellowships or PhD, etc. If I have done a certificate course in particular specialization for the nursing, I would speak I am a certified nurse with a special interest in emergency nursing. For the technicians, I am a laboratory technician with 4 years of experience in pathology field, histology field, or in a microbiology field or a biochemistry field, etc. Whatever your experience in the field, you should mention here. For the hospital administrator post, if you are applying for, I would speak I am a qualified hospital administrator with 2 years of experience in multi-speciality setup. And if I am a hospital administrator with particular skill set or a certification in the quality standards, I would speak I am a qualified hospital administrator with a training in NABH standards implementation. You can also include your degree like MHA, MPH, etc., MBA in healthcare or hospital management. You can also include in this punchline. And for the dental specialist, I would speak I am a dental specialist with a qualification of MDS endodontics. So in likewise, you should choose as per your background, as per your experience and the specialized training. You should prepare your professional punchline according to these examples. Now for the nursing professional, if they are appearing for an interview, an interviewer asks you to tell me about yourself. Let's see the example for the nursing professional. So what could be my answer? Make sure your answer within 1 minute you should complete it. So I will start with good morning sir, madam. I am Sandeep Patel from Rajkot, Gujarat state. I am a certified nurse with special interest in critical care nursing. I did GNM from ABC Nursing College, Ahmedabad. I have done my 6 months of internship with X hospital. After that, I go further study of fellowship or certification master in critical care nursing, and currently I am working with Y hospital as a ICU nurse. During my tenure, I did 200 plus IV cannulation procedures, 100 plus urinary catheterization, assisted 50 plus endotracheal intubation. I have observed or assist 30 plus upper GI endoscopies. Also, I got a training on NABH nursing standards and its implementation. So in that way, you should include your qualification, your experience and training attended. Make sure in your last portion, while you are explaining your experience, it should also portray your skills. So that's why the number of procedures or number of patients you have seen, observed or documented, kind of that numbers, like 100 plus IV cannulation or 200 plus assisted particular surgeries with particular doctor in a particular department you have worked. So you should mention that numbers in your pitch, in your answer. It gives a confidence to the interviewer and idea that yes, it shows your competencies for that you have applied for particular post, and it shows your competencies, skill and knowledge. For the medical professional, let's say the another example. Good morning sir, madam, I am Dr. Sandeep Patel from Rajkot, Gujarat state. I am a trained uro-oncologist with qualification of MCH Urology. I have done MCH Urology from XYZ Medical College, Delhi in 2018. I have worked as an assistant urologist at Multispeciality Hospital, Delhi for 1 year. After that, I have decided to follow my special interest in uro-oncology. So I have joined fellowship in uro-oncology and robotics surgery at ABC Hospital in 2020. And during my tenure, I have done 200 independent general urology surgeries, 100 plus robotic urology assisted during my fellowship tenure, and 50 plus uro-oncology surgeries I have performed. So that way your answer will be completed with your education, area of interest, this training, specialized training you have attended, and the post you are applying for. For example, in this case, the doctor is applying for the uro-oncology consultant post in a hospital. So the interviewer will get to know that yes, you have in a particular field you have got training as well as you have a work experience during your tenure of number of surgeries related to your field. So at last, again, what things you need to include? 6 things. 1, greetings. 2nd, your full name, your native place. 3rd, your professional punchline. 4th, your recent qualification. 5th, training attended. 6th, work experience, and portray your skills, number of procedures and patients you have observed in this section. And it should be completed within 30 seconds to 1 minute. So what interviewer is looking for while asking this question? In your answer, what they are looking for? 1, they are looking for a qualified candidate. Competency, where knowledge and skills. Past experience related to a job role. Stability, so long-term association with a hospital or a particular organization, they are looking for candidates. So in your resume, if you have switched jobs frequently within a 1 year or few months, it gives a negative impression to an interviewer that you are not stable in your particular job, and it may goes a negative part in your interview. So it is preferable and it is advisable that you should not switch frequently the organization and job. So while joining any particular job, make sure that you are planning to join it for at least 2 to 3 years. And most important aspect is interviewer is looking for the candidate should be comfortable for the job location. So whenever you come across particular job announcement and you see that that particular job vacancy is in a particular location, you must be aware of that particular location and make sure that you are comfortable, because after in a particular phase 1 and 2 in an interview, and you end up with that, oh, you are not comfortable that particular location, ultimately it's a waste of time for the interviewer and your as well. So which interviewer doesn't like it, because they have already mentioned in their job announcement that this particular vacancy in a particular location. So you should apply. While you are applying that particular job post, that means it is self understood that you are comfortable for that job location. So in your interview conversation, things should not be come up that you are not comfortable for that job location. And then after, flexibility on duty hours. So you must be prepared while you are appearing in a hospital. So we all know that hospital is a 24/7 unit to run upon, and there are all the healthcare professionals have a different shift is going on as per the duty hours. There are different shifts like in the morning hours, evening hours, late evening hours, night duties as well as. So you should be aware and you should be comfortable for that such duty hours. And last part is within their salary range policy. So there is always, for any interviewer, the salary part is always a last thing, because before discussing on a salary part, they always want to know about the candidate, want to assess what is the qualification, the work experience, whether this candidate is fit for their organization or not. And always there is a room, there is a negotiation part for both the way for the interviewer, because every organization want to onboard the sincere and competent team member on board. So there is always a space for the discussion, but you cannot start salary part in your first conversation. So this could be things you should keep in mind while appearing for a particular interview. And thank you very much. If you are looking for the healthcare jobs, you can search on jobs.docthub.com. You can also contact, if you are a recruiter, and you can contact our Docthub talent acquisition team at jobs@docthub.com. You can call upon 92653 90357. So stay tuned with Docthub for such healthcare career and practice upgraded related solutions. Thank you. Thank you very much.